Hi, I'm Lauren Masi, Doctor of Physical Therapy and Board Certified Orthopedic Clinical Specialist. I'm also the owner and Clinical Services Director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about assistive devices. Do you need one? How to use one safely and appropriately? So what is an assistive device? Well, I have some examples here today. We have a single point cane, a front wheeled walker, and some axillary crutches. So when it comes to assistive devices, it's going to depend on your level of balance, strength, and what might be going on. So sometimes people need these after a surgery, after an injury, and it's going to depend on the restrictions that your doctor put upon your weight-bearing status. So what I mean by that is, some surgeries you might not be allowed to put any weight on a particular lower extremity, so they might recommend axillary crutches. Our goal always when it comes to physical therapy and returning you back to your normal is to try to transition you to the least supportive device as quickly as possible and wean you off appropriately so that you can get back to walking without any assistive device. Sometimes you might be using a cane or a walker and you haven't had an injury or a surgery. It's just because maybe your balance is a little poor and we are concerned about your fall safety. Remember, we definitely don't want you to fall and potentially further injure yourself. So, to get started on which assistive device you should use and how to have it fit appropriately, we'll start with the most supportive. So in this situation, the most supportive assistive device we have today is this front wheeled walker. When it comes to your positioning for your arms, and this does carry over to both the crutches and the cane as well, the height of the assistive device should be at a level where your elbow is at about 30 degrees. We don't want it too high and we don't want it too low where you can lean on it. Remember, it's just assistive. It's not supposed to hold you up completely. So in this case, one thing that I want you to consider is when you step forward, that your elbow is not too bent and that you're not leaning over your walker. I'm going to back up a smidge here to kind of get started. There's another type of walker called a pick-up walker, which doesn't have any wheels. They both would be fit the same way. It's how you would use them that changes. So let's imagine that this is a pick-up walker, meaning there's no wheels. The biggest thing that you have to remember is that when you lift it up to move it forward, you don't put it too far forward that you're reaching and leaning towards it. But as the name entails, you pick it up, you place it slightly forward, and then you would step both feet in between the walker. Now, this is much less common nowadays, now that we have amazing technology like these rolling walkers. So we put little tennis balls on the back just to help that back part slide a little bit. But with a front-wheeled walker, you would take one foot and try to keep your center of mass in the confines of the walker. Then you can roll it slightly forward as your next foot is going. Again, what you don't see me doing is pushing the walker way out here and trying to catch up with it. That could put too much pressure on the walker if I'm leaning on it, that the walker could shoot out in front of me and cause me to fall. So again, that would be our most assistive device. Then, hopefully with your physical therapist, you're working towards getting stronger and more balanced, and we might be able to transition to a single point cane. Now, there's different types of cane bases. As I mentioned, this one is a single point. They have quad canes, which have 4 points on them. They have hemi canes, which also have 4 points, but they have a flatter side just to help with leg clearance. So there's different reasons that we might give you those different cane bases, but the first thing to note, and most important for all of them, is cane height. So if you relax your arm down by your side, the handle of your cane should fit in the wrist crease, and or if you rubbed your hand on the side of the leg and you felt that bump that sticks out, your cane handle should be right about there. So actually this cane could go down one more for me to be at a more appropriate height. There we go, perfect. So if I let my arm hang at my side, the handle fits right in the wrist crease, and there's my greater trochanter, or that bone that we feel on the side of the hip. So now I have the appropriate height. Now, one thing when you go to walk off with the cane is it does matter which hand you have your cane in. And unfortunately, watching Hollywood movies and TV shows, they don't always do it right. Sometimes that's for dramatic effect, and sometimes I just wonder if they even talked to someone about it. But your cane should be held in the hand opposite your side of injury or your side of weakness. So in this case, if I had a left knee replacement, or if I have weakness in my left leg, my cane is in my right hand. In essence, your cane becomes a place that you can put extra weight on to take weight off of the affected leg. So as I go to walk with my cane, One strategy is to put the cane down at the same time as the affected leg, so I can lean on it a little bit as my other leg comes through. And again, we move together. Okay, that would be the correct use of a single point cane. Now, when it comes to crutches, those are most commonly issued post-surgery. So usually you're going to start with bilateral axillary crutches. Axillary meaning they go in your armpits. When it comes to crutch use, I'm just going to show you with one for the ease of me not dropping things today. The crutch hand placement should follow that same pattern that we talked about for the walker and the cane. It should be at about 30 degrees of bend. You shouldn't be able to lock your elbow straight, but it also shouldn't be so high that it kind of kinks your shoulder forward. I'm going to move my hair out of the way. As for clearance here, you don't want that crutch jamming up in your armpit. You want to have about a 2 to 3 finger clearance to your armpit, because remember, the crutch isn't what's holding you up. You will be holding yourself up by displacing weight onto the handlebar. Both crutches are set at the same height, and some crutches have nice little cheat sheets for your height on the knobs on the sides so you can see. So now when it comes to crutch use, same thing. Your assistive device is assisting you to take weight off of the affected side. So again, we're going to say my left leg is the affected limb. Maybe in this case I had an ACL reconstruction. So now as I go to walk, there's many different patterns that you can use for walking with crutches. We're just going to cover a couple of the most basic. So again, in the beginning, maybe I'm not allowed to put any weight on that foot, right? So now my crutches become my left foot as I hop my right leg through, and my left foot isn't even on the ground. So that's a swing through gait pattern. As I'm cleared to start to walk more, we're going to put the crutches down with my left foot, and I can push into the crutches as much as I need to off-weight my affected leg as I step through with the other one. So again, the crutches will go with my left leg to help me off-weight the affected leg. And oftentimes you'll get instructions from your doctor like, oh, you can be 20% weight bearing or 50% weight bearing, and that's how much weight you're going to put into the crutches to take off of your leg. In our hopes to get you off of your crutches as soon as possible, you might then go down to one crutch. It would be used the same way as a cane on the side opposite your affected leg, and it moves at the same time the cane would. So it moves with your left leg, and you step through. And then before you know it, you will be crutch free and back to normal. Again, please make sure you are using your assistive device as well, that they are fitted for you, because any poorly fitted equipment could result in injury or even contribute to you falling or creating bad habits that are going to make things harder when you get back to your normal daily activities. If you have any other questions or need any assistance, please reach out to Bay Area Physical Therapy today for a complimentary consultation. Thank you.